Welcome back, everyone. We know if you're dealing with those varicose veins, there's a new way that you can treat it that's less invasive. It's even faster, and it's helping you get back to your normal life. Destry has the details.
Today, we're stepping into one of the Valley's most innovative medical centers, Sonoran Vein and Endovascular. Dr. David Nye is here with us now, a board-certified vascular surgeon and medical director. Thanks for talking with us today.
Thanks for having me.
Yeah, why don't we start with just what services you offer here?
So here at Sonoran Vein and Endovascular, we're a full-scope vascular surgery service where we provide services ranging from carotid artery disease to aneurysm repairs to peripheral vascular disease and even venous disease.
And what do you specialize in?
I love treating peripheral vascular disease and limb salvage, providing limb salvage techniques.
Yeah, and what about people who are coming here? What kind of problems are they having?
They can come with all sorts of problems ranging from swollen, achy legs, painful varicose veins, wounds on their legs. And we'd love to treat those sorts of patients.
Okay, and if they are having trouble, is it easy to get an appointment?
That's one of the things we pride ourselves in is how easy it is to make an appointment. Although we're very trusted in the community and we receive a lot of patients every single day, we can get to see you very quickly within a short matter of days to a short couple of weeks.
All right, and not only that, one way it's easier for you to see everyone is you have several locations.
Yeah, in the state of Arizona, we have 5 locations and even one in New Mexico. In the Maricopa County region, we have 3 locations.
Yeah, that's terrific. And you also have a big team, and we're going to meet some of them now. Dr. Julio Rodriguez is a board-certified vascular surgeon and also does the fellowship training program at the Arizona Heart Institute. In fact, he was also voted as one of the top vascular surgeons in America by Newsweek magazine. And we're here now with Dr. Rodriguez. And Dr. Rodriguez, why don't we start with something you specialize in? It's PAD. What exactly is that?
PAD is similar to plaque disease or blockages in the artery. It's a short for peripheral arterial disease. Those are the patient that comes to you complaining of pain. They can tell you, doctor, I walked this amount of distance and immediately cramps and pain started in my calf.
So the main symptoms are pain when walking. What are some other symptoms?
Yeah, that's a good question. Not only pain, but sometimes there's people that doesn't have a good sensory, so the manifestations are a little different. For instance, tiredness and fatigue of a leg. It could be also changes of the color of the skin, like discoloration. In some more advanced cases, it could be even gangrene or changes of darkenings in the skin. There are some others that are starting a very interesting way. For instance, they got a minor trauma, minor injury in the leg. They got a wound and the wound doesn't heal in a reasonable time. That kind of brings a suspicious for peripheral vascular disease.
Okay, and people who are seeking treatment for this, how do you treat it here?
Well, initially we have to do the right diagnosis, which is very simple. An ultrasound helps a lot to determine that. Once we establish that the patient has a significant disease, then one of the best way to treat them is with a very minimal invasive technique. Now we have a lot of advantages in technology that allow us to solve those issues with minimal risk.
Yeah, that is terrific to hear. And now we're going to meet another colleague. And finally today, we're talking to board-certified vascular surgeon, Dr. Dawn Olson. She's going to tell us more, and we're talking to you about venous disease. Describe what it is.
Sure, thanks for having me.
Yeah.
So venous disease is typically referred to as venous insufficiency or venous reflux. The veins are responsible for returning the blood from the lower body to the heart. There are these valves that are one-way valves, and when we walk, the muscle contracts and it returns the blood level by level until it reaches the heart. So over time, as we age or gain weight or get pregnant, our veins become a little more incompetent, and those valves have to work harder, and so we develop insufficiency or reflux in those valves. And instead of the blood all heading north, some of it pools in the lower legs, and we get heaviness or tiredness and cramping in the legs. And when the disease progresses for several years, people can have discoloration or even ulcers in the legs, which is typically at the ankles. The discoloration is this reddish kind of brown appearance that we call a brawny appearance. And at that time, the skin has already changed. It's thickened and doesn't heal right, so that's the risk then.
Yeah, you want to get treated. What do you do to help this?
So first, we get you into compression. And then we need to do a venous ultrasound that will look for any evidence of insufficiency or old clots. And then from there, we can make our decision of how to treat it. The typical management are ablations or injections, and it depends which veins are involved.
All right, very good. So you can get it treated, and you want to do that before it gets worse. And really, everyone, if you want to learn more about Sonoran Vein, it's super simple. Go online to sonoranvein.com. Easy to make an appointment to. Just call the numbers on your screen.